Welcome to the American Heart Association's Science-Based Health Journey. This program is designed to help you manage your health. The information is derived from the American Heart Association's scientific guidelines and statements. Together, with our scientific volunteers and leadership, we are here to support you as you follow your journey to better heart health. This journey will include learning about your heart, developing the knowledge and skills you need to promote heart health, understanding the numbers associated with heart health, establishing priorities, goals, and an action plan around your needs, uploading measures including blood pressure, weight, and glucose, tracking health behaviors like physical activity, nutrition, stress, and medication adherence, taking quizzes, participating in challenges, learning when and how to access the healthcare system, establishing a support system, learning how to communicate with your healthcare team and caregivers, and helping you make good, well-informed decisions about your health. Understanding heart disease can be confusing and even intimidating. If you've experienced a heart attack or have been diagnosed with a heart-related condition, it can be overwhelming and hard to know where to start. The American Heart Association has created Life's Essential 8, which are 8 areas associated with heart disease. These 8 areas include physical activity, nutrition, weight, smoking, sleep, cholesterol, blood pressure, and glucose. To this list, we've also added medication management and stress and emotions. These are the basis for you to build your personalized health journey. Understanding cardiovascular health requires a lot of new and unfamiliar terms. Many of these terms are long, but they're necessary for managing your health. We've built an essential word bank of terms, and each week, new terms, definitions, and synonyms will be introduced to you. Finally, a key part of achieving your goal is establishing your support system. Your support system can include a social media site, like the Support Network, your healthcare team, including your healthcare provider, or friends, family, coworkers, or even other patients that will help you stay accountable. You will be asked to participate in a challenge based on the weekly theme. We encourage you to track your insights through a private journal or post on the Support Network. This week's challenge is to identify what is important to you. Write these down. You'll use them next week as you build your care plan. The idea is to go a little bit above what you normally do. For example, you may add a few extra minutes to your exercise. The challenge is to identify what is important to you. Examples might be your health, your family, your finances, or your career. To get started, you will complete the Life's Essential 8 assessment, watch the video on Life's Essential 8, establish your support system, participate in the challenge identifying what is important to you. Okay, time to get started. Good luck. Let's begin your health journey. This journey will be based on your own priorities and the things you need to work on. The health journey is your individualized plan for managing your condition. The first step is to identify your priorities. Priority areas include physical activity, nutrition, weight, smoking, sleep, blood pressure, cholesterol, glucose, medication adherence, and stress. Select at least one, but no more than 3 priorities. For each priority, you will select your goal, which is a measurable outcome such as losing 10 pounds. Timeline: I will achieve the goal by my birthday. Action plan: specific steps you will take to achieve the goal. Your support system: your assessment of how important this is to you. If you're not sure which priorities to choose, we suggest you start with physical activity and nutrition. You will complete an assessment of your overall knowledge of your heart health. Over the course of the program, your knowledge and ability to act will increase, resulting in a lower risk of a cardiovascular event like a heart attack or stroke. The challenge is to do something you enjoy. This might be spending some extra time with your family or listening to your favorite music. Doing things you enjoy makes you smile and reduces your stress, resulting in a healthy, happy heart. To establish your plan, you will set your goals and action plan. Watch the video on goal planning. Complete the heart health knowledge assessment. Participate in the challenge. Do something you enjoy. Okay, time to get started. Enjoy. It's time to start planning your physical activity. The American Heart Association recommends 150 minutes of moderate activity or 75 minutes of vigorous activity. An example of moderate activity is taking a brisk walk. Vigorous activity might include jogging. If it's been a while since you've been active, or if you've recently experienced a cardiovascular event like a heart attack or stroke, or you've recently had surgery, you'll need to start slowly. Your challenge is to increase your physical activity. You can do this by increasing the time engaged in physical activity or the intensity of that activity. Take an extra walk or add a few minutes to your walk. You can also increase your pace. To build physical activity into your health journey, watch the video on exercise and physical activity, take the physical activity quiz, participate in the challenge by increasing your physical activity. Before you know it, you'll be feeling healthier and stronger. Okay, time to get started. Enjoy. Did you know that food is the strongest drug you put into your body? So paying attention to your nutrition plan can greatly impact your ability to manage risk factors like cholesterol, blood pressure, glucose, and weight. Dietary guidelines include eating a variety of fruits and vegetables, choosing fiber-rich whole grains, choosing poultry and fish without skin, eating a variety of fish at least twice per week, selecting fat-free, skim, or low-fat 1% dairy products, avoiding food containing trans fats, limiting saturated and trans fats and replacing them with mono and polyunsaturated fats, cutting back on sugar-sweetened beverages, choosing foods with less sodium, and if you drink, do so in moderation. Listen, don't get overwhelmed. Instead of trying to meet all of these recommendations, select the ones that are most closely related to your nutrition action plan. For example, reduce fats for cholesterol, limit sodium for blood pressure, or limit sugar-sweetened beverages for glucose. If you're not sure where to start, focus on adding fruits and vegetables and fiber-rich whole grains to your diet since they impact a broad range of risk factors. Here's the challenge: reduce your calories. You can do this by reducing the portion sizes of some of your meals or by replacing higher calorie foods with lower calorie foods. To build nutrition into your care plan, watch the video on nutrition, take the nutrition quiz, and participate in the challenge by reducing calories. Okay, time to get started. Mental health is a key component of overall heart health. The relationship between mental health and heart health is complex, and it includes stress, emotions like depression and anxiety, healthy behaviors, and overall well-being. Experiencing a cardiovascular event or being diagnosed with a cardiovascular condition is a stressful experience. It's important to know how to manage the stress in your life. These simple techniques will help you deal with stress, including positive self-talk and stress management techniques like deep breathing. Depression and anxiety can be a result of a cardiovascular event and can make treatment more difficult. Be sure to discuss your feelings and emotions with your healthcare professional to discuss treatment options. Also, stress and emotions can impact your ability to engage in healthy activities, as well as your ability to avoid unhealthy ones. Staying engaged in your well-being through healthy self-care activities like diet, exercise, sleep, and taking your medications is an important part of managing your heart health. Incorporate mental health into your health journey by staying motivated and committed to your plan. If you're struggling to stay on your plan, you should discuss this with your healthcare professional. There's more to staying heart healthy than just eating right and exercising regularly. Let's add sleep to the list. Indeed, sleep plays an important role in overall health and well-being. By the same token, healthy diet, regular exercise, and low stress may promote the sort of deep restorative sleep that is essential for good cardiovascular health. Studies show short sleep duration or poor sleep quality is associated with high blood pressure, elevated cholesterol, and atherosclerosis. And habitual short sleep increases the chance of cardiovascular events. Not getting enough sleep is associated with poor diet and weight gain, diabetes, inflammation, and stroke, heart attack, and death. So, how much sleep do you need? The American Heart Association has added sleep to its definition of ideal cardiovascular health, now called Life's Essential 8. The AHA recommends 7 to 9 hours of sleep per night. Build sleep into your health journey by going to bed and waking up at a consistent time, sleeping in a dark, quiet place at a comfortable temperature, banning electronic devices from the bedroom, avoiding caffeine and large meals before hitting the pillow, and getting plenty of exercise and physical activity throughout the day. Okay, time for a nap. Let's talk cholesterol. What is it exactly? It's a type of lipid consisting of cholesterol and triglycerides. Since fat does not dissolve in water and your blood is predominantly made of water, your body wraps these fats in proteins called lipoproteins. They can then easily travel through the blood like ships at sea. They're broken down into two types, LDL and HDL. LDL cholesterol is called bad cholesterol, and it's associated with an increased risk of another heart attack and stroke. HDL cholesterol is the good kind, and it's associated with a reduced risk for another heart attack or stroke. Effective ways to manage cholesterol include taking cholesterol medications as prescribed, being more physically active, reducing dietary cholesterol and saturated fat, maintaining an ideal weight. HDL cholesterol is increased with exercise, weight loss, and avoiding tobacco. In 2018, the American Heart Association published new cholesterol guidelines. Rather than focusing on LDL treatment goals, the new guidelines focus on overall cardiovascular risk. Treatment decisions are made jointly between the patient and the healthcare professional. So the first step is discussing treatment goals with your healthcare professional. Treatment usually consists of both medications and therapeutic lifestyle change. Be sure to take your medications as prescribed. You'll have a lipid profile measured 2 to 4 times per year. Finally, follow non-drug approaches, including increasing physical activity, reducing dietary cholesterol and fat, and managing your stress. Here's your challenge: reduce your fat intake. You can do this by replacing foods high in fat with low-fat options. Watch the video on cholesterol, take the cholesterol IQ quiz, participate in the challenge by reducing fat intake. Here's to getting more HDL in your system. Most of us are familiar with the dangers of high blood pressure. It can lead to heart disease, heart failure, and stroke. The good news is that lowering blood pressure results in a lower risk of heart attack, stroke, or the onset of heart failure. Blood pressure includes two numbers, systolic and diastolic. The systolic pressure is the pressure within the blood vessels with each heartbeat. The diastolic pressure is the pressure in the blood vessels between heartbeats when the heart is at rest. Blood pressure is affected by exercise and physical activity, sodium and fat intake, caffeine and other stimulants, changes in weight, and emotions. Effective ways to manage blood pressure include being more physically active, reducing sodium intake, maintaining an ideal weight, managing emotions, reducing stress, taking blood pressure medications as prescribed. The best way to manage blood pressure is to know your numbers. Monitoring your blood pressure at home will help you understand how your blood responds to your environment. As we've already discussed, making lifestyle changes like increasing physical activity are effective ways to lower your blood pressure. In some cases, your healthcare professional will prescribe medications to control your blood pressure. It's so important to take your medications as prescribed. So, making lifestyle changes, monitoring your blood pressure, and taking your medications will help your healthcare professional see how effective your treatment plan is working. This week's challenge: reduce your sodium intake. You can do this by eating fresh foods, avoiding processed and refined foods, and salts. Don't forget to watch the video on blood pressure, take the blood pressure IQ quiz, participate in the challenge by reducing sodium, and remember to minimize your stress, get your steps in, and hide the salt shaker. You can do this. Managing your health means managing your glucose. We've all heard about the effects of diabetes where the body does not produce or properly use insulin. Insulin is a hormone that's needed to carry glucose into the cells. When you eat, your body breaks down food into sugar or glucose. Glucose is used as a source of energy by your body. Sensing what you've just eaten, your body releases insulin, which is made by your pancreas. Insulin then carries the glucose from the blood into your body's cells to be used for energy. This energy supports all of the body's functions needed to stay alive. Effective ways to manage glucose include being more physically active, balancing carbohydrate intake with physical activity and medications, maintaining an ideal weight, taking diabetes medications as prescribed. If you have diabetes, you should test your blood sugar at various times throughout the day to learn how your glucose levels respond to diet and physical activity. Keep track of these trends and report them to your healthcare professional. Treatment may consist of both medications and therapeutic lifestyle change. Be sure to take your medications as prescribed. Finally, follow non-drug approaches, including increasing your physical activity, balancing carbohydrate intake, maintaining a healthy weight, and managing your stress. Your challenge this week is to lower your carbohydrate intake. You can do this by replacing foods high in carbs with low-carb options. Watch the video on glucose, participate in the challenge by reducing carbohydrate intake. Even reducing your carbs by just a little could help you a lot. Good luck. Today, we're going to tackle the dreaded word, weight. There are no health benefits to being overweight, but you probably already knew that. Being overweight places an increased workload on your heart. It's related to high cholesterol, high blood pressure, and diabetes, so it increases your risk of having a heart attack. The good news is that this is one thing that you have direct control of. By changing your energy balance equation, being more active, and consuming fewer calories, you can lose weight and reduce your risk of a heart attack. The typical American eats too much food, too many calories, too little fiber, too many refined and processed foods, too much fat, particularly saturated and trans fats, and participates in too little activity. Yes, there are plenty of diets out there, but guess what? Diets don't work. Humans are designed to be hunters and gatherers. The problem in our world of unlimited food is that we do most of our hunting and gathering at fast food restaurants. Einstein was right. E equals mc squared, with E being exercise, M being mass or weight, and C is for calories. The point is that when we put food in our mouths, it can only become energy or mass. Energy is in the form of physical activity, and mass is what's left over, around our bellies or on our hips. One common tool used as an indicator to determine whether you are at a healthy weight is the body mass index, or BMI. The BMI is an indication of your weight status: underweight, healthy weight, overweight, or obese. A BMI of less than 18.5 is underweight. 18.5 through 24.9 is in the healthy weight range. 25 through 29.9 is in the overweight range. And a BMI of 30 and above is in the obese range. So, if dieting doesn't work, what should you do? Start by making small changes to your energy balance. If you're not sure where to start, you can reduce portion sizes, limit between meal snacking, slow down your pace of eating. Here's your challenge. Change one eating habit. Just one habit alteration can make a difference. You can do this by eating a nutritious breakfast, drinking more water, slowing down your pace of eating, or avoid snacks in the evening. So, watch the video on losing weight. Take the energy balance quiz, participate in the challenge by changing one eating habit. Good luck. You can do this. Taking your medications as prescribed is an important part of managing your heart health. Your heart is an engineering marvel, and it's the center of your circulatory system. It functions as a pumping station, a power plant, and an electrical company. The medications you're taking are designed to reduce the workload on your heart and allow these important functions to continue. To get to your maximum benefit, it's important to take your medications as prescribed. If you have trouble with costs or side effects, you should discuss this with your healthcare professional or pharmacist to see if there are alternatives. If you've had a heart attack, it's likely you'll be prescribed medications from the following classes: antiplatelet agents, statins, beta blockers, ACE inhibitors, and ARBs. You may also be on medications to control the rhythm of your heart, reduce the chance of blood clotting, and control chest pain. It's important to make a list of your medications. The best source of your current medication list is you. Also, make note of any symptoms you're having and discuss this with your healthcare professional. Finally, if you're having trouble with the cost of your medication, you should discuss this with your healthcare professional or pharmacist. In some cases, there might be a generic or alternatives, but never change or stop taking your medication without your doctor's approval. Here's the challenge. Find a relaxation strategy. It might be listening to music, reading a book, deep breathing, or meditation. So, watch the video on medications. Take the quiz on medications. Participate in the challenge by finding a relaxation strategy. Okay, take a deep breath. You're doing great. Great job! You have completed the health journey. Before you move on, you'll need to complete a follow-up Life's Essential 8 assessment so that you can document your progress. You also need to develop a plan for sustaining the success you've achieved so far. You can update your care plan by changing your priority, resetting your goal, or revising your action plan. We are so proud of you for pursuing your ideal cardiovascular health. Keep at it. The benefits always outweigh the inconveniences. If this is the end of the road for you, good luck on your journey and your pursuit of ideal cardiovascular health.